I'm just going to ask you some questions and then see what you have to say about it. Okay. Myth 1. If a boy gets injured or hit in his private area during childhood sports, can it permanently impact his ability to have children later?
Not always, depends on the extent of the injury. Minor injuries are not going to permanently cause sterility, and it shouldn't discourage boys from playing. Of course, sports where there is a higher risk of genital injury, they can use pads for protection. If the injury has been severe enough to cause a testicular torsion, which means the testes get twisted, the blood supply gets cut off, or the capsule of the testes ruptures, that can cause problems in fertility later on in life. But not every injury
Not every
does that.
injury. Does eating a lot of protein automatically improves egg quality?
Well, protein is important for egg quality, but so are a lot of antioxidants and minerals as well. We do encourage couples to have a high protein diet, but egg quality depends on a lot of other factors, mainly the age. And no amount of protein will actually reverse age, though it is good to have a well balanced, nutritious diet that does include a good amount of protein along with other antioxidants and minerals.
Minerals. Can keeping a laptop directly on your lap or keeping a mobile phone in your front trouser pocket destroy or decrease sperm count?
This speculation has been around for a number of years now. But the cause and effect has not been scientifically proven as such yet. Yes, we are seeing declining sperm counts, but that could be due to so many reasons. What concerns us more than the laptop or the mobile itself is the heat that these devices sometimes generate. If you're sitting with a laptop on your lap for very long, sometimes you feel the laptop is getting heated. The testes are outside the body for a reason. They need a temperature 2 degrees less than the internal temperature of our body for spermatogenesis to even occur. So the other organs are inside, the testes are outside to keep them cooler. If the temperature around the testes is going to be repeatedly high, spermatogenesis can get affected.
IVF babies are smarter than naturally conceived babies?
No, that's also a misconception. Neither are they smarter nor are they more dull. But then sometimes, it could be that as opposed to the same couple having conceived on their own, we do know that there is a higher maternal age. Paternal age has an impact as well. Then we already spoke about things like high BMI, other metabolic disorders. When a couple comes to us, we do try to correct all this. So lifestyle changes, antioxidants, supplements, maybe somewhere, if they improve the gamete quality, they could lead to better outcomes as far as the babies are concerned as well. Although, as of now, this is just a tale. It's not been proven scientifically, but there could be a reason.
So, does undergoing IVF mean that women must be on absolute bed rest for the entire 9 months?
Oh my god, no, not even for one day after the embryo transfer. This is another myth that is one of the commonest myths that people come to me with. There is absolutely no scientific evidence that bed rest after the embryo transfer is going to increase the chances of implantation. In fact, there is enough evidence that bed rest can cause so much more harm than it can do good. If you look at natural pregnancies, they don't occur because women start sleeping after ovulation. They are going about their activities, doing everything. I tell my patients also which cheetah stops running after she gets pregnant and which whale stops swimming. Look at nature, it will teach you. Bed rest is not required just because it was an IVF. It can cause more harm than good. It slows down blood circulation, it slows down metabolism, it causes stress because they go into overthinking. So it is important to stay active. All routine activities can continue after the embryo transfer, including the workout that their body is already accustomed to doing.